Hi family, I am Dr. Mo and I am your educational director for the Global Professional Association for Colon Therapy and Colon Therapists. This video is all about bowel management after cancer, radiation, and chemotherapy. I'm going to share a couple of tips with you, and we're going to just start with the first point. There's going to be 3 points, but the first point is the actual cancer treatment and therapy tends to dry the body out more so than not. It actually sucks up all moisture in the body. And as you know, as a colon therapist, that the main ingredient that helps our body operate the way that it is supposed to and the way that it is designed is water. So without a shadow of a doubt, you definitely want to start taking maybe 4 ounces of mineral water added to your regular spring water to keep hydration going, to keep it moving so that it doesn't dip too far down. Once your hydration dips down, your recovery time after your exposure to chemo or radiation is a little bit more taxing on the body when it shouldn't be, right? So the more hydrated you can stay during your time period and even after your treatments, the better your recovery will be. A couple of herbs that create a very dewy sensation in the body is aloe vera and peppermint together, actually. They create a very beautiful synergistic blend of hydration, moisture. It is a protective barrier as well. So it will hydrate everything from mouth to anus. And that's aloe vera and peppermint mixed together. You can get that in a capsule, or you can mix aloe vera and peppermint together as a tea, or if you have a powder, you can mix it together and drink it in water. It's totally up to you, but those 2 herbs together are phenomenal at keeping the body very dewy, and it's very nice for the skin. It's very nice for the hair as well, which is something that most cancer patients need, is assistance with moisture. Another herb that's very hydrating is slippery elm. I absolutely adore slippery elm. I take it in a capsule every other day. It's really, really, really beneficial for women who might still be having a menstrual cycle while they are going through their cancer treatments. This is going to help the uterus as well stay soft and dewy. I've noticed that as I'm working with clients who are still women who are having a menstrual cycle and going through chemotherapy or radiation. They notice that their cycles tend to come back. They're a little bit more fuller. The color is redder or brighter. So it helps the body stay very dewy and soft. So that's slippery elm. So the second point I want to go over is just full body nourishment as a whole. I highly recommend that cancer patients and clients utilize soaking tubs, bathtubs, soaking your feet, soaking your hands. Soaking for cancer clients and patients in warm water, just warm water in general, maybe a little bit of baking soda to soften the water, is amazing. You can actually put aloe vera in the water as well, mix it thoroughly in the water, and it feels phenomenal on the skin. And again, when cancer patients are going through their treatments, it dries the body so everything is pulled and it's tight. So if you're sitting in water, the body starts to plump back up. And now the client can rest, and now their treatment can move through the body and do what it's supposed to do, including the colon and keeping the colon moving. When you lower the bottom half of your body in water, you increase circulation, you decrease stagnation, lymphatic movement continues to increase, and you start funneling waste through the channels that need to be funneled. So this is an excellent way for cancer clients and patients to stay hydrated, to stay mobile, no stiffness moving or collecting in the body. And then also too, this is really good If there are any hemorrhoids present, the soaking in the water will soften the hemorrhoid and then pull the hemorrhoid back into the body naturally. So it's really, really, really nice if there is any bloating or distension or pain in the lower trunk of the body. Soaking in hot water or warm water, not hot water, warm water on a regular, consistent basis, if not daily, is going to definitely increase bowel movements. It's going to increase motility. It's going to strengthen the colon walls, and it's going to help the nervous system soften so that a bowel movement can happen. It's phenomenal. And then the third point that I definitely want to make is that sometimes when cancer clients and patients are going through their treatment, their taste buds will go through a shift. What they used to like, they don't like now, and what used to be really sweet is not sweet, and vice versa. What I recommend is that clients start slowly introducing eating right for your blood type. That will always swing the body back to where it needs to be so that your digestion can swing back to the way it is, so that your colon can swing back to the way it's supposed to be and relax. And that's the way the protocol of the body moves through. So oftentimes clients' appetite will either increase to the point where they are eating way too much because they can't taste the food, or they're only eating junk food because of the high content of like salt and flavor and seasoning. So that can affect and will affect the colon, and now you're having irritation in the stomach at night. You're having really, really difficult bowel movements that are painful because they're hard due to the not food that the person is consuming. So if you swing back to your blood type, of course you need to know your blood type, but once you know your blood type, there are plenty of ways in which you can find it. And also GPACT has a PDF that you can purchase of all the blood types and the blood type ways that we should be eating and the protocols on the back. So you can definitely purchase that at gpact.net, GPACT.net, and that can help and guide your cancer patients as well. So what am I trying to say in regards to bowel management after cancer therapy? Is the main goal is to rehydrate. Hydrate, then rehydrate some more and continue to hydrate, because cancer therapy is very, very drying. It can be very, very drying to the body. And the last thing you want to feel is dry as you are trying to heal. So if you can give the person relief from hydrating the body, then the colon won't be stressed out and it will start to operate the way that it's supposed to. If you would like training in this area and would like to become a colon therapist, GPACT does offer training from foundation all the way to instructor level. And we also have specialty courses as well that you can tap into. Visit gpact.net, and we would love to help bring you into our industry so that you can be of deep and high reverent service to our community. Until then, stay blessed.